All right, we are live on YouTube. Welcome to the Weiner Wellness Center Virtual Summit. We have an awesome presentation set up for you with Jeff Niznik, who works at the Weiner Wellness Center. He is their kinesiologist, I would say, right? You have your muscle testing, which is amazing. And you're going to share all about back pain, everything that we need to know regarding back pain, muscle pain, joint pain. And you're going to give us the solutions for it. So I'm just going to let you take it away, Jeff, and share your PowerPoint.
Okay, so Tracy, don't go away yet.
Oh, I'm not. I'll stay here with you.
Okay, so once you hand it to me, my PowerPoint is pulled up on the computer. How do I get it up on the
share
screen?
down at the bottom, the little green button.
Okay, so we're ready to share and do that now. Okay. Here we go.
Awesome.
And then I want
slideshow from the beginning at the top.
Slideshow.
Yep. And then all the way to the left. You got it, sir. We're ready.
Awesome.
Woohoo! Look at that.
This is not the beginning, but
that's okay. Just go back. There you go.
There you go. Thank you so much, Tracy. Appreciate it. All right, folks. So we're ready here. So sorry about the delay. We had a little bit of technical difficulties, but nothing that we can't overcome. So my presentation today is on gut, back pain, joint pain, muscle pain. Your body responds to stress and nutrition, and we're going to talk about that. So a little bit about me. I went to Carnegie Mellon. I went to Center High School. I've been 28 years in the health and healing arts field. A little bit of an FDA disclaimer. I'm not a medical doctor. I don't treat, I don't cure, I don't prevent any medical diseases or conditions. This presentation and these statements are for informational purposes only and are not intended to treat, diagnose, cure, prevent any disease. And should you have any medical condition, you're advised to seek a licensed healthcare practitioner. And good luck with that. Okay, so I'm an energy testing specialist, a muscle tester, and an energy tester. I'll ask your body what's going on with reflexes, and your body will tell us where it has weaknesses. People don't realize energy is supposed to flow in all these different energy meridian systems of the body. You can touch different reflex points in the body, and your body will show you how well the voltage, your energy, your life force, your chi is flowing through these different places. And where we find you have weaknesses, we can find out what energies, what nutrients strengthens these weak reflexes. And it's a very, very simple thing to do. They've been doing this for a long, long time. In the early 70s, actually in 1939, George Goodhart was practicing chiropractic, was doing this kind of stuff. So joint problems and pain don't have to be a life sentence. If you have pain, you've had pain for years and years and years, you don't have to have it your whole life. I had pain and significant dysfunction my whole life, and I don't have a fraction of the issues I used to have. I got better as I got older here, particularly the last 3 years. So with diet, nutrition, digestion, voltage, and time, you can detoxify, you can rebuild, you can restore your health, the health of your joints, and just about anything else that can be alleviated. So joint pain can originate from, and you see that first bold one there, a lack of nutrition. And then that leads to poor digestion. Ingesting the 12 bad foods can lead to pain. Low voltage from teeth, from a root canal, infected crown, or mercury-filled tooth, from scars, from a diet, from an acidic diet, from an acidic lifestyle and emotions, mechanical misalignments, poor posture, toxic buildup in the body, pathogens. All these things can lead to pain in the body. Body basics. So just as well as all structures of the body require 91 different nutrients, joints as well as all structures of the body require 91 essential nutrients to properly function. They all require adequate voltage to fuel the metabolic processes within all the cells to properly replicate all the cells. And you got to identify what source your lower voltage originate from. And movement is also necessary for proper joint function. I listened to Dr. Jerry Tennant on the Coast to Coast AM radio show. This is back in 2010 and 2011. So 9 and 10 years ago. And I used to listen to Dr. Weiner, Dr. Gallagher, Dr. Courtney, all these different guys, Sharon Satterfield, Len and Joe, all these people for years and years and years. I never heard them mention voltage. And Dr. Tennant says, if you have pain, if you have dysfunction, you have low voltage. And that perked my ears. I was like, what? What did he say? He said, yes, if you have pain or dysfunction, you have low voltage. You got to figure out what the source of your low voltage is. I'm like, wow, this super piqued my interest. And your energy in your body is dependent on how the acid and alkaline balance in your body, many different things. And if you're mineral deficient and other nutrient deficient, you can have low voltage. If you have an infected crown, mercury fillings, root canals, that can block voltage in your body. It's many things. So we can help to, with kinesiology testing, muscle testing, you can help to identify what is lowering your voltage. And then, what we do about it is, what I do here at the office. So folks, as we talk here, realize that, I see patients, I see clients that do this. Call the Weiner Wellness Center at 412-922-9355, and I'll spend an hour with you and test you on all these things, and we'll try to find out what's going on with you and what nutrients your body needs to fix itself. In other words, I can't fix you, only you can fix you, and you can fix yourself, and that requires nutrition. So discs, cartilage, ligaments, and tendons, all joint components are living tissue. And all living tissue in the body has a nutrient supply, is constantly being replicated and replaced, and also has a waste removal system. All living tissue requires 91 essential nutrients to have a chance of repairing properly and functioning maximally, as well as adequate voltage to fuel those reactions too. So move on here. Now, arthritis is inflammation, of one or more of your joints. The main symptoms of arthritis are joint pain and stiffness, which typically worsens with age, but not necessarily so. My personal success story. So let's just talk about myself for a minute. So it turns out I had osteoporosis in high school. And I had what was called Osgood-Schlatter's disease. That's where the point of your tibia, your knee, just below your knee, your bone there sticks out further to show you a lot of knee pain. My father had that, and he had a surgery for that. And his mother, my grandmother, she had knee issues as well. I was listening to Dr. Joe Waller talk about this. He says Osgood-Schlatter's disease isn't a disease. He goes, it's osteoporosis. He goes, you all ate a terrible diet, and you had mineral deficiency, and you had osteoporosis. I'm like, when I started thinking about it, he goes, you all ate the same things. You all had the same diseases. It wasn't a genetic thing. It was a nutrient deficiency issue. And of course, as I nutrified my body, that problem went away. March 10th, 1980, I was in my buddy's dorm room at CMU, and I put a record on a record player, and something blew out my back, and on the ground I went. 15 minutes later, campus police came by and helped me get up and get to the hospital. I'm sitting there in a wheelchair after they x-rayed me, and the nurse came out and said, the doctor looked at your x-ray, didn't see anything wrong, you're free to go. And I looked at her, I'm like, what do you mean free to go? I can barely walk. And I had to argue with her to talk with the doctor. And the doctor came out and he says, well, I looked at your x-ray, I didn't see anything wrong. You must have strained something. Here's a prescription for some muscle relaxers. Here's a prescription for some painkillers, and off he went. I looked at him bewildered. I'm like, did I step into a different reality, a different alternate reality or something? So for 3 months, I could barely touch my knees. And that summer, I went and saw a chiropractor for the first time, and he adjusted me, and it was miraculous. The pain relief was absolutely miraculous, but the pain came back, and I get adjusted, and the pain came back, and I'd get adjusted, and the pain came back. And I've had no stability in my lower back. I couldn't deadlift, couldn't do squats. I couldn't go jogging, playing a basketball, catching a rebound, my back would go out. So just shooting hoops. I had no stability in my spine for most of my life until recently. And then I was doing some curls one day and tore something in my brachialis in my left arm. And for 2 years, my left arm hurt me until I started working out again, until I forced myself to train. And your body will respond to stress. That's the purpose for telling you this. Your body will respond to stress. So once I started working and stressing that area, your body will rush nutrients to help repair the area. Whenever you work out, you slightly tear down muscle tissue, and your body rebuilds it stronger. And where those muscles attached to tendons, and tendons attached to the bones, those bones are getting stronger. So by moving and doing weight training exercises, you're actually rebuilding your body. And it was amazing how within 2 or 3 workouts, my 2 years of arm pain went away. A little typo right there, sleep apnea. I also had sleep apnea my whole life, and I only have an issue with sleep apnea if I eat foods basically prepared outside of the house. Anytime you go to a restaurant, they usually put lots of different chemicals in those foods, flavor enhancers, all these endocrine system disrupting chemicals. The more foods you eat that you make yourself, the more organic vegetables you eat, the less chances you have of getting these chemicals in your body and reacting to basically not digesting food properly, reacting to many foods. I had sleep apnea. When I cleaned that all up, my sleep apnea disappeared and I sleep very well. I wake up before my alarm. I used to wake up exhausted every day of my life. But now by changing my diet, changing my lifestyle, it's not really an issue anymore. And then a knee pain. I've had all kinds of knee issues a good bit of my life. And it got so severe that 3 or 4 years ago, I could barely walk. My knee would just click, 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 clunk, click, 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 clunk every step I took. I couldn't even go for a short, slow walk with my wife and her dog because my knee was miserable. And now, once I learned about, you need all these different nutrients, once I started taking a digestive enzyme, once I started taking all 91 nutrients and I stayed away from foods that inflame me, you can test on all these foods and see what foods, with kinesiology testing, in just a few minutes, we can scan 3 or 4 pages of foods and show you what you have a problem with. And I stayed away from these foods and everything in my life turned around. I can squat all the way down to the floor with no knee pain anymore, whereas I could barely walk 3.5 years ago. And then CircuCore and Super K2 Plus. I was getting leg cramps, severe leg cramps. If I did anything active, I would get leg cramps. I'd sit there at night watching TV and I would go to get up and my whole inner thigh from my hip down to my knee would just lock up for 5 minutes and wouldn't break. And you just think you're going to die. And when both legs cramp at the same time, you would rather die. And that doesn't happen anymore. And what happened was, once I started taking that CircuCore and Super K2 Plus, my daily back pain, knee, upper back, lower back pain, knee pain, everything really subsided. And Super K2 Plus has 5,000 units of D3 in it, 5,000 units of vitamin A, 500 micrograms of K2 and 100 milligrams of strontium in it. And I believe what was happening with me was I was getting nutrients in my body, but I wasn't getting them out of the bloodstream very well and into the bones because most of the meat that's prepared out there, most of the beef out there is raised from cattle that don't graze on grass anymore. And their level of K2 in that meat is very low, if any. And you need that K2 to get that calcium and you need vitamin A, vitamin D, and the K2 to get that calcium out of your bloodstream and into your bones. And I believe my bone pain, I always thought I had joint pain, muscle pain. I had bone pain also. And it's surprising how I'll do something very active, like I dug a 68-foot long ditch one day. And I had no pain after that. And usually I'd be a significant amount of pain and be exhausted for 3 days. And that's not the case anymore. So basically the point of telling you all this is that no matter what your health challenges are, if we can identify what foods you have a problem with, if we can identify what we can do to help you digest food. I also took a digestive enzyme in the past 3 years that I never took before. Digestive enzymes, and identify what foods you have issues with, or what kind of digestive enzyme may help you with. Staying away from wheat products. Wheat is exceedingly difficult for most people to digest. Stay away from wheat, barley, rye, and oats. Change your diet up, change your lifestyle, and your body can change. There's no magic pill for this. No, you can't just take a pill and keep your same crappy lifestyle that brought you to the health challenges you have. You can't keep that lifestyle and take a pill and expect it to change. You got to change your lifestyle. That includes, changing up your diet, change the way you detoxify, change the way you fortify your body, move in your body, and life can change. Okay. So digest 91 essential nutrients and special formulas, the digestion connection. So whenever you don't digest your food properly, incomplete products of digestion can get in your bloodstream. Your thymus gland polices the bloodstream and attacks proteins that shouldn't be there with an immune or inflammatory response. So in your sternum, you have your thymus gland and it scans your blood. And when it sees proteins that shouldn't be there, it alerts your immune system to attack it. So when you don't break down your food properly, incomplete products of digestion can get in your bloodstream. And the more porous your intestines are, more toxins can also leach into your bloodstream, and your body ends up attacking all this stuff. You get all this inflammation and pain and fatigue, and you're wasting nutrition fighting things that should be, food should be fortifying you. You end up fighting your own food. So spend an hour with me. Let me test you and see what goes on to help you get on the right nutritional program to correct all these things. Okay, on the body, just below your sternum, on the right side and the left side are these reflex points. And one alludes to you may need to have a need for more stomach acid supplementation or digestive enzyme supplementation. If you don't digest your food properly, this can really reduce actually nutrients getting out of your food and into your body. And so you got to be able to digest your food properly. So we can test these reflex points and see which one your body wants, which group of supplements your body may need, and figure out which one's the best for you. I have 16 different digestive formulas I test people with, and we can find which particular one out of the 16 is your body says is the best one for you. Alkalizing your body. So all diseases flourish in an acidic environment. The more you alkalize your body, the better your chances of overcoming your health challenges. The basis of Dr. Max Gerson's Gerson therapy involves alkalizing the body, well, along with juicing, supplementation, and diet. These are key factors to also consider. See a chiropractor. I mean, it was amazing how when I saw, it was Dr. Julius Burgel. He was at the center exit. Right now I've been adjusted by, I think, over 15 different chiropractors in the past 40 years. And Dr. Orbach and Dr. Honeyman, you'd be very, very difficult to find chiropractors that will treat you better than these guys do. So mechanical misalignments can put undue pressure on your joints. Well, I stood on a scale at this one chiropractor's office, and it was a bilateral scale where it was separated. And my right side of my body was 14 pounds heavier than the left side of my body on those scales. That can put undue pressure on that side of the body, on that knee, and the opposite side of the body on the hip, because your basically body's torquing and twisting. So chiropractors are excellent at assessing your mechanical structure and adjusting the spine, and thereby correcting mechanical misalignments and restoring neurological function. That's the key. It isn't about cracking your bones. In between all of your joints in your spine, you have nerves coming out on either side between each of those vertebrae. And if you twist the vertebrae or shift it or tilt it, you can irritate that nerve, and whatever part of that body that nerves feed, you may have reduced function. So chiropractic is about restoring the positioning of your joints and your bones to limit any type of irritation to your neurological system. So body meridians, we did this already, acid alkaline balance. Am I going the right way? So everything you eat and everything you drink has an effect on the acid and alkaline balance of your body. So as a general rule, foods that are rich in minerals tend to alkalize the body, and conversely, foods that are mineral poor tend to acidify the body. The blood connection. Now, your body will always maintain the alkalinity of your blood. On a pH scale, your blood will always be 7.35 to 7.45. 7.0 is neutral. Above that's an alkaline environment. Below 7.0 is an acidic environment. So there are 6 different buffering metabolic processes that your body has to neutralize the acidity of your blood, the acidity of your body caused by your metabolism, by your exercise program, by your thoughts and other things. And it will always make your blood fall in this range, 7.35 to 7.45. So here's a little graph of a pH scale. A neutral reading 7.0. Above that is an alkaline environment. Yeah, we could do this. And below that is an acidic environment. Your blood is always in this range, 7.35 to 7.45. This creates the voltage in your blood of minus 20 to minus 25 millivolts. This is where your blood will always be no matter what. And this is what Dr. Tennant was talking about when he said, if you have an issue with pain in your body, you have low voltage. So if you, say for instance, you're doing some construction, you smash your thumb with a hammer, your body will alkalize that area, which in turn, all that swelling and the redness, that's part of the healing process. That changes the voltage to minus 50 to minus 60 millivolts. At that voltage, you can activate your stem cells to regrow your tissues like brand new. It's very, very important. The more negative voltage you have, now this negative sign in front of the voltage here, that means that's an electron donating environment where it has an abundance of electrons to donate to all the tissues around for cellular reactions and so forth. The more negative voltage you have, the more oxygen, I don't know what happened, the more oxygen will store into your tissues. The more oxygen rich your tissues are, the less any disease has a chance to live or thrive. Now, the guy that invented biopsy needles discovered when he put a biopsy needle into a cancerous tumor and he measured the electrical potential across it, it was always plus 30 millivolts. That plus sign means that's an electron stealing environment, very oxygen poor environment. And this is a great breeding ground for all the pathogens in your body. So voltage is very, very important. And the more minerals you get into your bloodstream and into your cells, the more you stave off all these problems. Now, the problem with getting minerals in is most what Dr. Wallach, Dr. Glidden, these other guys say, is that the more you eat wheat and barley and rye and oats, it coats the villi in your intestines, particularly here in America. The Italian wheat has a fifth of the gluten that our wheat has in it, even the organic stuff here. That coats the villi in your intestine as it blocks your absorption of minerals. The more mineral poor you become, the more acidic your body is and the more trouble and problems you have. Let's go down. We just do that. Okay. So the blood pH connection, they say if your blood pH varies to a level of about 7.1 or worse, basically you're going to die. It's very, very important. Your body always maintaining in that range. If you're significantly mineral deficient or have other issues, it's a real problem for you systemically. So here's the thing, your parathyroid gland, this is located on the back side of your thyroid gland in your neck, and the parathyroid gland produces parathormone. It's a hormone that's made by the parathyroid gland, and it's critical in maintaining the calcium and phosphorus balance in your body. So here's a picture of your thyroid gland, and on the back side of that are these 4 little purple dots. That's your parathyroid glands, and they produce parathormone, and that's what goes to your bones, and it takes calcium and phosphorus out of your bones and puts it in your bloodstream to keep your blood pH at that 7.35 to 7.45. So basically, the more acidic you are, the more that parathyroid gland's got to work at stealing calcium and phosphorus from your bones to keep that blood alkaline, and that can lead to bone pain, that can lead to arthritis, and lead to a whole host of problems. Okay, so it's basically your parathormone takes the calcium and phosphorus from your bones and puts it in your bloodstream. Deficiency of parathormone results in abnormally low calcium in the blood, which is hypocalcemia. And then the kidneys, so the body's putting all this calcium and phosphorus into the bloodstream. Your kidneys are going to filter that blood and can filter out about 80% of that calcium. And the most common types of kidney stones are comprised of calcium and phosphate. Calcium oxalate, calcium phosphate, uric acid, struvite, and cysteine. There's typical types of kidney stones. Excessive parathormone leads to elevated calcium levels in the blood, hypercalcemia, and calcium deposition in the cartilage, which is arthritis. So if you're too acidic and your parathyroid gland is working overtime to make your blood alkaline, this can lead to more kidney stones. It can lead to more arthritis. An acidic diet, can lead to osteoporosis, arthritis, and possibly clogged kidney filter units and kidney stones, pain, and kidney damage. So to reduce inflammation, avoid consuming any wheat, barley, or rye, or oats. Almost everybody I test on fails in a kinesiology test response to wheat, barley, rye, and oats. Avoid processed sugars, added sugars, soft drinks, sweets, candies, breads, pastries, refined carbohydrates. This is going to lead to more acidification of your body and probably more pain. The stomach acid connection. So you need strong stomach acid to digest calcium and other minerals. You need this strong stomach acid to break down food into building blocks and to minimize wasting nutrition on inflammatory responses. So if you don't break your food down properly, and incomplete products of digestion get in your bloodstream, your body gets all this inflammation from attacking it, and that leads to pain and problems. So big pharma to the rescue, or maybe not. So blocking stomach acid significantly adds to osteoporosis, joint degeneration, and kidney stones, from drugs. Drugs like Boniva block osteoclasts, leading to very brittle bones. So there's 2 basic types of bone cells, osteoclasts and osteoblasts. Osteoclasts tear down old, weak, brittle bones, and osteoblasts to build new, weak, strong bones. These drugs block your body's ability to tear down the old, weak bone. So you can be, stepping out of a building, step off a curb, and your leg will shatter from the bone being too weak, and their hip will shatter, something like this. And then drugs like Celebrex and Vioxx have killed over 140,000 people from heart attacks, but they're okay to be on the market as long as they have a warning label on it. I mean, give me a break. So pain medications and the adverse drug reactions to them are the 4th leading cause of death in the United States. This is only behind cancer, heart disease, and strokes. Millions of people take some form of pain medication every single day. And prescription or over-the-counter, the vast majority of people taking these don't realize their incredible dangers. So from 1999 to 2016, more than 200,000 people died in the United States from overdoses related to prescription opioid drugs. Prescription drugs. Overdose deaths involving prescription opioids are 5 times higher in 2016 than in 1999. This is becoming a real major problem. So there are more than 100 different forms of arthritis and related diseases. The most common is osteoarthritis, rheumatoid, psoriatic, fibromyalgia, and gout, and all of them cause pain in different ways. So osteoarthritis occurs when the protective cartilage on the ends of your bones wear down over time. Here's a picture of a healthy bone and a bone with osteoarthritis. So we're trying to speed along because we're a little bit behind schedule here. So gout is a form of arthritis caused by excess uric acid in the bloodstream. The symptoms of gout are due to the formation of uric acid crystals in the joints and the body's response to them. I just want to make sure we're okay. Okay, the symptoms of gout are due to so gout is most classically affects the joints in the base of the big toe. It could affect your knees, it could affect your low back, your neck, also any other joint. But if you see that big toe swelling up, chances are you got gout. So these uric acid crystals build up in the joints and basically cause pretty miserable pain. So what is a low purine diet? Did we skip? No. All right. So a low purine diet is a meal based on foods that are low in purine content. Purine is a substance that is found in foods and is produced naturally by the body. Purines are broken down by the body and changed to uric acid. So kidney issues. The kidneys normally filter the uric acid and leaves the body through the urine. However, people with gout sometimes have a buildup of uric acid in the blood. This buildup of uric acid could cause swelling and pain, a gout attack. A low purine diet may help to prevent gout attacks, and proteolytic enzymes with and between meals may help with the whole situation. And likewise, I also had issues with gout. It was about 4 years ago. I was hobbling pretty badly, and I actually went to MedExpress. I never see a doctor, but I had to do something. And they thought I had gout. And I'm like, really? And that's when I started looking into digestive enzymes and taking digestive enzymes with my meals. And these proteolytic enzymes between meals, it's not an issue. Occasionally I'll have a flare of pain in my foot or my knee, but rarely now. The difference was I'm digesting my food better. My kidneys probably work better because of all the nutrition I've done. My whole body's working better. That's the thing. There wasn't no magic pill that would fix this. Once I nutrified my body, and basically you're replacing cells all the time. So replace them with better cells. You can do that. You can replace your your poorly functioning cells with cells that work significantly better. That requires nutrition to do so, not a drug. You're not drug deficient, you're nutrient deficient. So what foods can I include? Foods that are low in purines, and eggs, nuts, peanut butter, low fat and fat-free cheese and ice cream, skim or 1% milk, and soup made without meat extract or broth. I haven't looked into why the fats of milk are a problem, and I don't know if this is just the medical industry saying, have low-fat milk and so forth. I haven't looked into that. So low purine foods continued. So water, staying hydrated helps the kidneys to remove uric acid from the bloodstream and building up in the body. Low-fat dairy products, low-fat and fat-free options are best for foods such as milk, cheese, yogurt, and frozen yogurt. I don't know if that's true or not. This is what I downloaded from the internet. I did not have time to research that. So rice and potatoes, fruits and vegetables. All vegetables are healthful, and a person should favor whole fruits and juices with no added sugar. There are some vegetables that are not so great for you. Vitamin C, good sources of vitamin C include grapefruit, oranges, pineapples, strawberries, bell peppers. They say people with arthritis have issues with bell peppers in the nightshade family, so you may want to stray away from those, tomatoes and avocados. Lean proteins. Doctors do not believe that small or moderate amounts of poultry and fish will raise purine levels. Eggs, however, a person should only consume moderate amounts of eggs. Don't know exactly why. And coffee and herbal teas. So what food should I limit? So medium purine foods are meat and poultry, crab, lobster, oysters, and shrimp. Vegetables that are moderate in purines are asparagus, cauliflower, spinach, mushrooms, green peas, beans, peas, and lentils, oats and oatmeal. Now, Dr. Waller says no oatmeal because most people can't digest it properly, and that will limit your absorption of minerals. And then wheat, German bran. High purine foods. These are foods that may limit, you want to limit or avoid if they're high in purines. Anchovies, sardines, scallops, mussels, tuna, codfish, herring, haddock, wild game meats like goose and duck, organ meats such as brain, heart, kidney, liver, sweetbreads, gravies and sauces with meats, and yeast extracts taken in the form of a supplement. So what other guidelines should I follow? Increase your liquid intake. Drink 8 to 16 8-ounce glasses of water a day, liquid in particular, at least half of that from water. And of course, limit alcohol consumption. Alcohol, especially beer, increases your risk of a gout attack. Beer contains a high amount of purine. So maintain a healthy weight. If you're overweight, you should lose weight slowly. Weight loss can help decrease the amount of stress on your joints. Regular exercise can help you lose weight if you're overweight or maintain your weight if you're at a normal weight. Talk to your healthcare provider before you begin an exercise program, of course. Okay, and then there's rheumatoid arthritis. This occurs when your immune system mistakenly attacks your own body's issues. Unlike the wear and tear damage of osteoarthritis, rheumatoid arthritis affects the lining of your joints, causing a painful swelling that can eventually result in bone erosion and joint deformity. Dr. Wallach says with rheumatoid arthritis, the joints may be being attacked by spirochetes. Spirochetes are flexible, spirally twisted bacterium, especially one that causes syphilis. He says he has had quite a bit of success with minocycline, the antibiotic. And others have had success with chlorine dioxide. If you want to look into that further, go on YouTube and look up Jim Humble for his miracle mineral supplement, chlorine dioxide. So here's a picture of some rheumatoid arthritis, what it does to deforms joints. And then there's psoriatic psoriasis. We're going to skim through these because we don't really need to get into depth on these things. This is what psoriatic arthritis looks like. Fibromyalgia, it's a medical condition characterized by chronic widespread pain and a heightened pain response to pressure. You touch a person with fibromyalgia, it's quite painful in many different parts of their body. But we got to look at how are you digesting your food? Are you eating things that are toxic? Do you have bad teeth causing problems? Are you have heavy metal toxicity? Have you had a bunch of different vaccines that may be interfering with things? So do what you can to get in here. Let me test you. Again, I don't treat, cure, prevent any of these things. We're going to aid and assist you in discovering where you have weaknesses on your body and discovering what nutrients strengthen your weak reflexes. We're going to discover what foods you have a negative response to, what foods that seem to be okay for you to eat. If you need some help digesting, processing food, all this is geared towards getting more nutrients into your bloodstream so your cells can function better than the way they do, including detoxifying naturally. Okay, fibromyalgia, we're going to skip. So foods that raise the acidity of a body, grains, sugar, certain dairy products, fish, processed foods. Now, there's a little caveat with this. The fish can be good, fish can be bad. Farm-raised fish that are highly toxic aren't so great. Basically what they're saying is because these things, like fish, doesn't have a lot of minerals in it. If you take a fish with vegetables, well, that's okay. Fish by itself, maybe not so okay. Processed foods are loaded with tons of chemicals that aren't so great for you. Fresh meats and processed meats, such as corned beef and turkey, processed meats you want to stay away from. Fresh meats, eat in moderation. Sodas and other sweetened beverages, these are terrible. Sugar is like the express train to Painville. Sodas, likewise, they acidify you and take you to painful as well. And then high protein foods and supplements, these are okay if you balance them, of course. Everything's about balance. You want to balance these proteins with other vegetables, other alkalizing nutrients. Foods that can lower the acidity of the body, of course, most of the fresh vegetables, including potatoes, most fruits, herbs and spices, including salt, mustard, and nutmeg, beans and lentils, some whole grains such as millet, quinoa, and amaranth, some herbal teas, fats like olive oil, avocado, nuts, and seeds, things that give you the building blocks for the anti-inflammatory hormones, the omega-3s. Soy, such as miso, soybeans, tofu, and tempeh. There's always a caveat with that one. 95% of all the soy in this country is genetically modified. So you're putting toxins in your body when you eat GMO soy. If you're going to do soy product, make sure it is organic. And then unsweetened yogurt and milk. So the dental connections, root canals, can infect and inflame your body every day with gliotoxins and thioethers. That's also something else I did. These two front teeth were root canals for 41 years. And every time I was kinesiology tested anywhere around here, it was super weak. And as well as the kidney and bladder meridian in my body were always weak because these two teeth are electrically connected to the kidney and bladder meridian system in your body. So I got rid of these root canal teeth 3.5, 4 years ago. And that was one of the things that really helped to my overall health picture in my body. So the toxins, the gliotoxins and thioethers that come out of an infected root canal are terrible. They say this is worse than botulism. So what do you do about this? Most dentists don't have a clue about this. They're not trained in this. But doctors, dentists that are biological dentists that are trained as naturopathic doctors, these are the guys that see because they'll be able to test you with kinesiology and test your teeth and show you what's a real problem, what's really interfering with you, and what is okay. You know, generally a mercury filling is not okay because it's blocking voltage and it's putting mercury in your body every day of your life. Your crown teeth can be okay if they're not infected. If they're infected, most likely they're blocking voltage to two organs in your body. And root canals, Dr. Tennant says there's really no real good root canal. And that's about it, so folks. So that's my presentation for today. The general gist of it is this. The more you nutrify your body, the more you increase the functioning of your cells, the more you detoxify your body, generally, the better your body's going to work. You know, the more nutrient poor you are, the more toxic you are, generally, the more your body's not going to work and you can have pain and dysfunction. So spend an hour with me. Come to the Weiner Wellness Center. Call us at 412-922-9335. Set an appointment with me, and we'll do what we can to get you on the track to help you heal yourself and get on the basically in better nutritional programs so your body can work the way it's supposed to do. So we see our friend Dr. Tracy Straub is back with us. So glad to see you again, Tracy.
Yeah, well, that was a great presentation. And Candace, she messaged me. She's like, on the express train to pain. Great line. So there's a couple questions that came in, if you don't mind answering.
Sure.
Laura says, I have never heard of massaging essential oils onto scar tissue to open meridians. Which oils and which brands would you recommend since I can't purchase at the Weiner Wellness Center? Well, you can purchase at the Weiner Wellness Center, and we will ship it to you for free, Laura. But I would like to know your recommendations, Jeff.
Yeah, so scars, scars are always test with. Sometimes scars are a problem. Well, most of the time, a decent scar is a problem, but sometimes it's not. So we'll kinesiology test the scar. If it is a problem, we'll see if frankincense, usually frankincense or lemongrass or lemon or myrrh or sweet orange, those 5 tend to strengthen the weak reflexes. But usually it's frankincense and lemon, or frankincense and lemongrass, or myrrh and lemon, and myrrh and lemongrass. Occasionally it's frankincense, lemon, and myrrh. It's different. You know, so everybody's different, but generally, as a general rule, one of the best ones overall, most of the time, is frankincense, lemon, and then lemongrass, and then myrrh, and then sweet orange, probably in about that order.
Yeah, I love frankincense. It's the king of oils. And probably one of the things people don't know about me is I'm a certified aromatherapist. So I went, yeah. And, you know, I used to be really big into essential oils, and they're such a great complement. They work a lot better in a nutrient dense body. That's one thing I always tell people, and in a hydrated body. And depending on how lipid friendly you are, right, how much fat you have, they will stay in your system longer for people that have more fat versus people that don't. One of my favorites for the actual scar was frankincense and helichrysum. Helichrysum was a great one, which actually helps with breaking down scar tissue. So I love helichrysum. It's not a cheap oil, but you can make it in a roll-on for people and dilute it out with some, fractionated coconut oil, and then add that frankincense to it. But your frankincense myrrh combination, I always called that Jesus juice. So it was a good one for healing anything.
Yeah, I found it very interesting that the people tested very well with gold, frankincense, and myrrh. So lemon, frankincense, and myrrh. Those three ones work very well with most people. And again, I wouldn't put this directly on your skin and dilute it with a coconut oil to reduce blistering.
Yeah, absolutely. Because, while people always talk about detox reactions with essential oils, one of the things that I notice is just sensitivity. You are putting something on your skin, and you could put anything on your skin and have a sensitivity to it. It doesn't mean the oil is bad. It just means to be careful. So your recommendation of dilution is always good. Is there any detox protocol that you recommend when you have any type of metals removed from your mouth or fillings?
Nutritional Frontiers Frontier Cleanse, Nutritional Frontiers Proline Greens, Metagenics Metallo Clear. Those three, usually people test really well on one of those three or sometimes two of those three. So any of those would be good. I would probably go with Frontier Cleanse overall, and then greens would be second. It's usually in that order.
And then do you take those the entire time before the procedure, after? How do you recommend taking the detox protocol?
Yeah, it's never wrong to get metals out of your body. So having that beforehand, great. During, I believe, great. Afterwards, great. How long afterwards? I test people on the metals kit. A lot of times they'll fail on mercury, methyl mercury, aluminum, all these different things. And they'll do a nutritional thing for about a month and come back again. And I test them again, and they test strongly to the metals. I said, let me see if anybody responds to continue to take this. And about half the time it's like, yes. But it's half the amount, and half the time it's like, they don't need it.
Okay, great. Diana says she likes frankincense unadulterated one works for me. Yes, good stuff. So last question here, pertaining to fibromyalgia, what are some of the products that you like to complement cleaning up the diet? What are some things that you recommend that they take nutrient-wise?
Yeah, Cybezyme, digestive enzyme. You got to be able to break your food down. If you're not breaking your food down, you're adding to the problem. Cybezyme, proline greens, getting metals and chemicals out of your body systemically. Frontier multivitamin, getting your cells work right. Omega-3D, give you building blocks for the anti-inflammatory hormones. Mineral rich, to give you 70 different minerals to get those things going on. And then moving, helping your lymphatic system, lymphatic tincture, lymphatic drainage, good thing to take also. And of course, come in and let me test you. We'll figure out which one's the best thing for you.
Or remotely, right?
Yeah, or remotely.
Or remotely. We heard about your brother's dog that you saved his life.
Yeah.
And even if you can't claim that, Jeff, let your brother think that. That's what I always say. Let people think it, then, but this was great. You had a lot of good comments. People really enjoyed your lecture. Thank you for sharing your knowledge. We're going to come back for the roundtable at 12:30 because we were a little bit behind due to technical difficulties. So I have posted the link on the website page, Weiner Wellness Facebook page, excuse me. You can go and you can click on that. You can get directly into the room with the practitioners. Our panel experts are Dr. Orbach from the Weiner Wellness Center, Jamie Doyley, and Joe Messino from Nutritional Frontiers. So tune in, join in. We'll be streaming probably live on YouTube again because Facebook won't let me do it. But we thank everybody for tolerating all the technical difficulties. And Jeff, as always, incredible presentation. I love when you talk about pH. That's one of my favorite things you talk about.
All right. Well, thank you so much, Tracy. We wouldn't be here if it weren't for you. Really, thank you so much. You're wonderful.
All right. We'll talk to everybody. Thanks again.
All right. Bye, everybody.